Hello guys. Today we have got a really great IGTV lined up for you. I'm just checking, as I always am, that I'm actually on the correct Instagram. Those of you who know me know that I'm often on the wrong one where I shouldn't be. We have got the doctor in the house. If you could request, go live. Hopefully Dr. Jose will be on. Dr. Jose, how are you?
I am fine, thank you. How are you?
Very, very good. Thank you so much. I'm so sorry. I'm so hopeless at these things that I have a few Instagram accounts and it has been known that I go on the wrong one sometimes. Everyone starts saying, "What are you
Is
doing
it?
on there? Where are you?" I'm so
Don't
pleased
worry,
to
it
see you
happens to
today.
everyone.
Oh, thank you so much. Well, if you don't mind if I read off my card, I just want to get exactly right who you are. So today we
Too
have
long of a
Dr.
description.
Well, I just wanted to get it right, and then you can add all of your details. Your ears will be burning and you'll go red and be embarrassed while I'm
Okay,
talking
yeah.
about you. But Dr. Costa is a consultant paediatrician and fellow of the Royal College of Paediatrics and Healthcare. You are a member of the core group of the British Society of Allergy and Clinical Immunology, Standards of Care Committee, and you've been appointed as the honorary clinical lecturer in allergy at Warwick Medical School. Currently, you lead the paediatric allergy service at the University Hospitals of Coventry and Warwickshire. Is that correct?
That's it. Yeah, yes.
Well, I
Well
couldn't think
done.
of anyone better to have on to talk about these issues that all the mamas and papas are dealing with their children at the moment, especially these days.
Yeah, of course. It's an ongoing issue. The problem about allergy is it's under-recognized and poorly informed, and especially in primary care, is an ongoing issue that we see, is that so much contradictory information that there is. And I saw yesterday from the questions that you sent me, there's so much contradictory
We've had
information
so
between,
many.
yeah, between the health visitors and GPs and whoever else. And the main problem about this is the training in allergy in the country is very, very limited.
Mm.
So GP trainees don't go through allergy training. Most of the doctors in the country don't have even 1 month of allergy, so they are completely unaware.
Which is
So
extraordinary.
yeah, it is. It is sad because as I was speaking to someone that I'm working with at the moment, Julian Poonam. The other day I was talking to her, and I sent her a few documents because we are writing a letter to Matt Hancock, and I sent her a few documents. She didn't even realize there's a massive document called the Unmet Allergy, the Unmet Need, signed by the Houses of Parliament in 2004, and it has never been put into practice.
Yeah.
So
Yes,
sad. It's
worked
very,
on.
very sad.
Yeah, under the carpet and gets missed.
Oh,
One
yeah.
it was one from later on, but actually, while we're on this topic, somebody
Yeah.
says, "How do you advocate for your child to get the best help when you just know something's wrong?" And it happens so often when we're talking about this. You go to your GP, you go back and back and back, and in the end, they
Mm.
say, "Okay, you've got to do something." But it often takes months and months to diagnose something like a milk allergy and things like that.
I would say sometimes it takes years.
Mm,
I've had children coming to my clinic uh, with an obvious cow's milk protein allergy, amongst other allergies,
mm.
when they were 7 years old.
Wow.
Yeah. I
And
had
what
a child.
sorry, go
Sorry?
ahead. I
I
say what?
had a child. The most unbelievable case was a child that was referred to me. The child was around, I don't, it was a girl, 9 or 10 years of age, in which the GP on the referral letter said that it was actually saying that the mother has annoyed him so much that he had no choice in to refer.
Mm.
And he said on letter, black and white, that he didn't believe that allergies existed.
Yeah, they don't. That's what they believe. But unless they've got something like hay fever, and then they do believe in it.
Yeah, interestingly, sometimes things that are completely not allergy,
Mm.
they refer as being an allergy. Like someone comes with a tummy pain. A runny nose, those are referred to me as an allergy. When you look at the history, that's nothing to do with allergies.
Mm.
So it's very, very odd. And it's sad. It's sad because if we had looked into quite a lot of children that we have nowadays that are adults and look at simple things like you say about hay fever, a lot of them would have not developed asthma because we can prevent it.
Early on.
Mm.
Yeah. Prevention's the key. I love your mug. I've
Oh,
got,
yeah. It's my minion one.
I love that. And you know, because we sent on a few, we have got loads of questions, and I'm sorry if some contradict each other. The first one we have is, my 3-year-old daughter has a peanut allergy, and I have peanut butter every day in my pregnancy with her. Could there be a link, and also could I grow out of this?
Okay. There's a bit of conflicting research on that one. So current research saying that mothers should include all sorts of allergens in their diet, apart of course if they are allergic to them, but they should include all sorts of allergens in their diet.
Mm-hmm.
Now, there is a study that says that potentially mothers that, because the protein is transferred into the amniotic fluid and the child is ingesting them, so in theory, you should be inducing tolerance to the child because he's going through the oral route, because they keep on swallowing. Mm-hmm. Now, there's an ongoing research that says that there's a possibility that it also can cause sensitization. And actually, there's a massive study going on in Scotland at the moment regarding that. So, despite that, what we say is to mothers, eat allergens, because the evidence so far is you will prevent it. In this case, the mother that eats the peanut butter throughout the pregnancy and the child is peanut allergic, is going to be impossible for me to say a yes or a no. The likelihood is it was chance. Because, and the reason for that, and this was something that I spoke about a while ago, is the presence of peanut protein allergen on the dust of houses in which they consume peanut. So, and because we know that the contact of any protein, of any allergen through the skin leads to sensitization and eventually can lead to an allergy, I wouldn't be surprised that what caused this child to become allergic to peanut was not mothers ingesting, but the peanut that exists in the home environment.
Ah, very interesting.
Mm.
Do you find with things like that, obviously not severe allergies, but more milder ones, do you find that children grow out of these or can?
It's impossible to predict. We would hope to assume that a mild allergy, children will outgrow it. But it depends, for me, it depends on a very important thing, or a couple of very important things. One, very early diagnosis. And following the very early diagnosis, a very early intervention. Because one of the things that I do is I do something called oral immunotherapy, in which I try to introduce allergens as soon as possible, even for children that tested positive. I try to do that. And I do things called boiled peanut challenge, in which I introduce smaller amounts and I try to build up. So by doing that, you really increase the chances of a child outgrowing an allergy. If you aren't able to do that and you delay, the likelihood drops a lot.
Really?
Yeah.
That's really interesting. My son has a big problem with pretty much all dairy, really, and I test the milk ladder often, and he sometimes gets a bit further, but it always upsets his tummy in the end when I get sort of skimmed milk or whatever the bit that they do. Would you say keep trying, keep trying?
So one of the things about the milk ladder, first, you know that there's 2 milk ladders. There's a 6-step one and a 12-step one.
Yes.
The 6-step one is the more recent one. The 12-step one is the more the older one.
Mm-hmm.
To be honest, for me, and the outcomes that I've seen so far, the 12-step milk ladder have worked better.
Okay. Because
some parents think and believe that there's too many jumps on the 6-step one. And one of the reasons why the 12-step one was removed is because they said that on higher steps there was too much sugar. Look, putting into perspective between the sugar and outgrowing an allergy, I would say outgrow the allergy.
Sure.
So I go for the 12-step. Now, when the child reaches a state in which they start having tummy upset like yours, what I say is go back to the step in which there's no symptoms. Stay there for a month or two. And after a month or two, try it again. Because milk ladder is this, it's trial and error. There's not one size fits all.
Of course. And someone's just said we're still trying to get past the first step of the ladder. Do you just say stop and then start again a few months later?
Yes, give it a month. Okay. Give it a month maximum. Don't go much more than that.
And you can't do damage with inflammation or anything if they're getting upset tummies.
That's the problem, you know, because if you're talking about something that is upsetting their tummies, we're talking about an inflammation process that is going on. So for you to imagine, if you get an inflammation on your thumb or on your finger, that inflammation, if you don't do anything at all, will take 15 days to go away. And this is basically outside. Inside, because of ongoing process, because the bowels do not stop, and you're not making the bowels not work anymore, sometimes the inflammation can take a little bit longer. And that's why we say sometimes, when it comes, for instance, for exclusions, we say 4 to 6 weeks period.
Yeah, it's very interesting.
To deal with all that inflammation process.
Great. And then one other question on the milk ladder. Would you say go for that standard 12, or lots of people have a different one that may use ghee instead of butter? A little bit, well, I wouldn't say holistic, but maybe not so shop bought. Do you know what I mean? If you want to be a bit more holistic.
It's, put it this way, when people did the 12-step milk ladder, there's a lot of foods that can go on each step. But if you put a lot of foods there, instead of helping parents, actually probably is going to induce even more confusion. So that's why they stick to 1 or 2 foods. But if your child is being seen by a good pediatric allergy dietitian, she or he can tell you, look, instead of this, if you can try this one. And a good example of that, for instance, is around the Midlands. As you can imagine, there's a massive Asian community. So there's an Asian milk ladder that we have around here. Because sometimes for them, finding those foods that are very Western, sometimes it's a bit more tricky, and also it's not part of their diet. So yes, by all means, it can be replaced, yes.
Fantastic. You're getting lots of wonderful comments. Somebody who's who you look after at Rugby Hospital, and lots of people saying, "I wish that you were my consultant." Very nice.
Thank you.
It's nice just to speak to someone who actually does address these issues that really worry us as parents, and we're always so often told by pediatricians, "Forget it, it's not a problem, move on." Yeah.
Oh, yeah, unfortunately, I deal with that very often, including some of my colleagues, pediatricians. Their knowledge of allergy is limited, and that's a good thing. That at least I have open doors, so people come and knock on my door and ask me all the times, including, and that's the thing that I tell to my old trainees, and especially the ones that are going to become GPs, I always tell them, look, you have my email address. Email me. I'll prefer you to email me and ask me a question than just send me a referral without seeing a patient. And this way, sometimes you can deal with the patient in the community instead of having all that troublesome time of coming to hospital.
Yeah, of course. Fantastic. Someone said, is it okay to give my newborn baby probiotics? Why would a breastfed baby need this if they get everything from their milk?
Okay. Yes and no. So, this comes into a very interesting and complex area of the allergy that I like, called biome depletion. So basically the lack of bacteria in the gut. So we know that as humans have evolved into more clean societies, with a 99.99 kill everything inside, bacteria has decreased in the gut of children. And breastfeeding is amazing, but you also need to think about how many children are born by cesarean section and not by normal vaginal delivery. And we know that being born by normal vaginal delivery will increase their gut bacteria and will decrease the possibility of developing allergies in the future. Now, coming to that point specifically, it's interesting. I opened an article. I have my laptop near me. And actually, there was a study done, published in 2020, about a specific probiotic that, if given even on breastfed babies, you'll decrease the incidence of hay fever.
Wow.
So we know that there is a few probiotics. It's not a matter of just getting to a supermarket, to a pharmacy, whatever, and getting a bunch of them and start taking them. There's specific probiotics that can be used. And that is the problem, is guiding people through the right probiotic.
Yeah.
Because there is probably hundreds or slightly less than 100 probiotics around being sold over the counter, online, and some of them are actually not useful at all, for nothing.
It's very difficult for new mothers to know what to turn to.
Absolutely, absolutely. But again, if they speak to a dietitian, dietitians have a wealth of knowledge when it comes not only to probiotics, but for diet in general. Even for non-IG mediated milk allergy, dietitians are excellent, and especially if they have an interest in allergy, they are excellent. And even for me, sometimes I'm speaking to dietitians asking for their opinion.
Amazing. Fantastic. Now another question. My 20-week-old breastfed baby has multiple allergies and we can't seem to get on top of it. I've been dairy and soya free for 14 weeks and gluten and egg free for 8 weeks. And as a result, there are all sorts of problems. She says they've got reflux, very unsettled, congested nappies, mucus, naps are terrible, waking every 2 hours. She's thinking about Neocate, and she just says, how long could it take for us to see an improvement in symptoms and hopefully see my baby more settled?
Okay.
Sorry.
It's a hard one. It's a hard one because what happens is every baby is different. So turning to this mother and say, look, I've done this in another baby and it worked, might not work for her. So we need to evaluate cases independently. And again, oh, Paula just said something. Thank you, Paula. Paula's tiny thoughts. And again, for situations like this, again, I need the involvement of the dietitian with me. Jumping straight into an amino acid formula like Neocate sometimes is not the best choice. Sometimes you need to see what else is involved. And I like to start from scratch. Jumping over the top very often complicates things. So starting with an extensively hydrolyzed formula is the best. Now, we could debate here the formulas that I use and the formulas that I don't use. And Neocate actually at the moment is one that I don't use. I don't use it anymore. There's others that I use.
What over that?
So it has to do with the evolution and the science that comes behind it. So at the moment, there's a massive component of studies related to one thing called HMOs, called the human mono-oligosaccharides, which basically is sugars that mothers produce on breast milk. Some mothers produce more than others. And it is felt that formulas that have HMOs tend to be actually more beneficial than the other formulas. Now, also, there's formulas that are lactose-free and not lactose-free. And also, it depends on the child poo. Is it liquid? Lactose-free. Is it solid? Put it with lactose. So, yeah. So as you see, it needs to be tailored for the person that we're talking about. So I would say that mother, if she's having so many problems with so many exclusions, first, she needs to think about nutrition for her, because she's already excluding a lot of things that are good on her own diet. Then nutrition for the baby. If the baby is exclusively breastfed, that's fine. But that child needs to be seen. And that child needs to be seen, again, an allergist, a dietitian, working together.
Together. Yeah, that's the key really, isn't it? Fantastic. This one is similar in a way. This is a 5-month-old. Has suspected cow's milk protein allergy, reflux, and really bad asthma. They're on alpha-amino milk and omeprazole reflux, but she seems to be really itchy with this milk, and reflux has got worse. They've said, I'm guessing because the milk's so thin, the omeprazole had been increased. Can I do anything to see if this milk is not sitting well? Or what can I do? She says a dietitian's also suggested Neocate, but she's worried about the reaction.
Okay.
Oh,
So first things, I agree with one thing entirely that she says, very thin. Any specialized formula is much thinner than the other ones. So several things that need to happen. One of them, you need to thicken the milk. So we use two things. Either we use Gaviscon.
hmm.
One of the big problems about Gaviscon is the constipation. So Gaviscon needs to be added, or if there's too much constipation, we add Carabel. So one or the other. One of the problems about Carabel is very similar to soya, and if there's already reactions to soya, they might react to Carabel as well. So again, thicken the milk. I would say start with Gaviscon to thicken the milk. I wouldn't change formula straight away. Let's do one step. Yeah,
Mm.
changing too many things only brings complications, only
Yeah,
brings confusion. No, don't do that. Yeah, thicken the milk first, and then address the problem.
yeah. Thank you. I believe that the lady who asked the question before that we were just talking about said, in that case, wouldn't there be another option for maintaining breastfeeding, or in your professional opinion, would it be formula only? That's for the one who was on Neocate
Okay.
and had the
Uh,
type.
if mother has enough milk supply for a child,
Hmm.
do not stop breastfeeding. We need to work around the mother and need to work around the child. Do not stop breastfeeding. The problem about breastfeeding in the country is most people don't understand how bad is breastfeeding in the country. We only achieve over 50% of breastfeeding babies on the first month of life. Not a lot above 50%. On the second month of life, less than 50% babies in this country are breastfed. So maintaining breastfeeding, and for me to look into it from the allergy cap on my head, please breastfeed. This mother needs support to work around what the dietetic needs are.
Mm.
Do not, if there's enough milk supply, the child is growing well, the problem is not going to be the breast milk. We can work on it. Of
Okay.
course, if mother doesn't want to breastfeed anymore, or if she doesn't have enough supply and needs supplementation, different issue. But if there's enough supply, no. Breastfeed. Keep
Good.
on it.
It's very funny with my last one, with my last child, I was breastfeeding really happily and it was going fantastically, but he had a big problem. I mean, his bottom looked burned when he, and I mean, he was just constant diarrhea and it just looked almost like you put an iron on his bottom. And
Yeah,
my pediatrician just said, you have to go on Neocate, you have to stop breastfeeding now. I was lucky enough to have a maternity nurse. She was the same. She said, just stop it. What you're giving is not right. So it's really interesting you say that. And in my heart of hearts, I really wanted to just carry on. But obviously the professionals were saying, no, now's time. This is too much.
it's not a lot of conditions in which we ask mothers to completely stop breastfeeding.
Mm.
One of the conditions, which is a very rare one, is FPIES. And FPIES, so FPIES is food protein-induced enterocolitis syndrome. So is FPIES stays for non-IG or delayed cow's-milk protein allergy, the same as anaphylaxis, stay for IG allergy. It can kill a baby. So FPIES, the most common cause of FPIES is milk, and it is extremely rare that breast milk can cause FPIES as well. So but because of the expression of milk protein on the breast milk, sometimes we ask mothers to stop breastfeeding for a while so the protein in their breast milk can be cleared. And it takes 8 days to
Wow.
clear the milk protein from a breast milk.
That's
There's an interesting research done on that one. But so, on that condition, we ask them to stop. We ask them to express, so they keep on having milk supply. If there's a milk bank donor around, please give the milk away instead of throwing it, and then start breastfeeding again. But now, stopping breastfeeding completely because there's something happening to the child, no, we need to work around the child and we need to work around the mother.
okay. Very interesting. Thank you. Next question. My baby suffers with reflux and is now 4 months old. Should I wean him early and where do I start?
Now, um, weaning into solids, that's a very common misconception. It's like a kind of an urban myth. If I give solids, they're not going to go up. No, it doesn't work like that. There are specific reasons for us to wean a child earlier. And those are to do with a strong family history of allergy, with siblings, older siblings with significant allergies and eczema and asthma. Those are the reasons you need to tell someone to be weaned at 3 or 4 months of age, especially into nuts. But weaning a child into solids will not solve reflux. What will solve reflux mainly is child growing, core muscles being more steady, and actually standing up and walking. A matter of gravity.
Makes
The
sense.
rest, yeah. So solids, just putting solids down, nah. It's not the same as giving a lot of Gaviscon and giving a massive lump on their stomach. Doesn't work.
Not gonna. Okay, really interesting. This is a little bit of a long one. I'm sorry. HV recommends omeprazole for 12-week-old reflux. I spoke to my GP, who seemed reluctant to prescribe. He mentioned not enough research on long-term side effects and some other negative connections, which he made me nervous about. Baby is fed. Do you often use this to treat reflux, and should I be worried?
Okay. I often use it. I often use omeprazole to treat reflux after I go through all the other stages to deal with it. Okay, especially when I talk about what was said, thickening the formulas or whatever, or even for breastfed mothers, we can still give Gaviscon. There's ways to give Gaviscon on mothers that are breastfeeding. Of course, it's not for them to take, it's to give directly to the baby. But so, we can do that. Now, omeprazole and any other medication, you need to understand that any medication in the market has side effects. All of them. There's no medication that does not have a side effect. Now, it is a balance between what is better. Is it the side effect, or is it the improvement in symptoms and the long-term problems about the symptoms? Reflux, one of the main things that we're worried about is food refusal. Because children will feed, but the way that they think, their brain thinks is, I feed, I release endorphins, I have pleasure. So I have to feed more because I'm in pain because of reflux. Now, they'll come to a point in which they, instead of doing this cycle, they start doing the cycle of, actually, if I feed, I'm going to have pain because I have reflux. We need to stop that. So giving omeprazole, yes, I do. I tend to give it for short courses. I'll give it for 6 to 8 weeks after I do all the other changes, and after 6 to 8 weeks, I stop. And I see if by stopping it, how are the symptoms? Do I need to carry on for a long period of time or not? So omeprazole, yes. Of course, omeprazole, ranitidine, which I'm not using at the moment, and antibiotics, we know that if we use them on the first year of life, increases the risk of developing allergies in the future. But again, it's the balance. Do you want to have a baby that is not feeding, that is not growing, that is not sleeping? Or do you want to take the chance and settle the baby down? Also, settle parents down, because sometimes they don't sleep at nighttime.
Yeah. Two of mine were on omeprazole as well. One of them's fine now, and the other one still has a really bad allergy to milk. So, like you say, it's taking up that balance. Another question. My 3-year-old was diagnosed with eczema when he was less than a year old. It's manageable when we're out. When we put on cream, it tends to be on his lower legs. Is there a reason that he only has it here, and will he grow out of it? I have asthma. Do you think that could be linked?
Okay. Being asthmatic, we're talking about it, and probably, I don't know if she has also hay fever or not. So we know that if there's a history of atopy in the family, there is increased risk of children developing also atopy-related symptoms, eczema being one of them. Now, why is it so particular to have on the lower limbs and not on the upper limbs? Very often has to do with clothing and rubbing of the clothing against their skin. It will, takes the top layers of the skin off. But also, if you imagine all the detergents and all that we apply, even if we use a lot of softeners, there's also chemicals there, and they in contact with the child's skin can lead to that one. So if it is a mild eczema that is managed with moisturizers, I wouldn't worry. I wouldn't worry about it. Very often, people that have eczema will have eczema for the rest of their lives. because eczema, you don't outgrow it. You can either manage it or not manage it. And very often, most people have a bit of eczema, and moisturizers are enough, and you can live with it for the rest of your life as long as you keep on using moisturizers. Also, the other thing is, another interesting study is the water in the country. You know, lots of lime scale.
A lot.
That's why I have families that are from mainland Europe, in which the incidence of lime scale there is far lower. What they say is, I don't understand. I go with my child over there, and when they reach there 1 week or 2 weeks later, the eczema has disappeared.
Yeah, you're
well,
right.
One is that, and the other one is sun exposure. Sun treats eczema.
And the sea.
Oh, yes.
Yeah.
So let's move all of us into a nice beachy location then.
That now, doctor, I tell you. Now, this is quite a broad one, but how do I know if my baby has a milk allergy?
Okay. First of all, they need to know the symptoms. And they need to know the difference between symptoms of IgE and non-IgE. If it is immediate symptoms, hives, swellings, vomits, and we're talking about minutes, we can sometimes expect it to happen up to 2 hours, but we would expect the hives, the swellings, the vomits associated. If it is this type of symptoms, is IgE mediated, we can test. We do skin prick tests, easy, and gives you a result in 15 minutes. If it is non-IgE mediated, so we're talking about many hours to 1 day later, and is mainly associated with either diarrhea, constipation, flare-ups of eczema and reflux, there's no test for that. There's no validated test for that. And the only thing that you can do is exclude, again, guided by a dietitian, exclude, reintroduce.
Okay. And that takes us on to actually someone's asking, what is normal in terms of stools and skin when introducing new foods when you're weaning?
Normal is, stool-wise, there might be change. Sometimes stool will get looser, because as you're weaning, several things are going to happen. First, is an interesting process, and we're talking about, if you're going back to probiotics that we talk about, actually, as you introduce a new food, you are introducing new bacteria into the gut.
Sure.
So the first time, and that's why we say start with small and then build up, the first time that you're going to introduce a new food, the gut is not completely ready for it. So it very often can get a bit of a loose stool. That's fine. They will recover from that. As long as it is not liquid stool, that's fine. I wouldn't worry. Skin, I wouldn't expect any changes.
Fantastic. What happens when children, often if they have tomato, they'll get a sort of, what happens with that sort of situation when your face goes a bit funny?
I refuse all of the referrals for that.
Why is that? Can you tell us?
Because it's not an allergy. So you're going to see that with tomato and strawberry are the most common ones. And then you're going to see a lot of the other berries that are going to also cause that condition. So 2 reasons. 1, most of these foods have histamine on them.
Okay. Sorry, I just not.
No, that's right. So most of these foods or these fruits have histamine on them, and there's a massive list of fruits and vegetables that naturally contain histamine. Histamine is what mediates an allergic reaction. So if histamine touches the skin locally on a baby, what's going to happen is going to cause a reaction, and normally is that redness around there. The other thing is you need to think about the acidity in the fruit or the vegetable. Like tomato is very acid. The acidity there, the skin of the baby is so soft, anything that touches it will make it worse. For you to have an idea, how often do you see babies that they have a lot of red patches and eczema, either the chin or below? And this is mainly, or if they use a dummy, and sometimes they have the shape of the dummy because of saliva. Saliva is a chemical, it burns. So if you imagine this, skin is very sensitive. I wouldn't worry about that.
And tell me, is that similar? You know, sometimes you eat a pineapple or a kiwi and you get that sort of itchy in your mouth and a little bit here. It just feels a bit fuzzy. Do you ever get that?
Okay. We're probably going now jumping in a completely different ballpark. Because what happens is, 1 can be one thing called a pollen foot syndrome, or an oral allergy syndrome, same thing.
Mhm.
So especially for people that have hay fever, that can happen. Two can be the acidity.
Yeah.
Three, and this is probably the most worrying one, especially with kiwi,
Mhm.
can be a latex allergy.
Latex.
Yes. So latex allergy is more commonly associated with banana and banana allergy,
Mhm.
but it's also known that can be associated with kiwi. So anyone that comes to me with the possibility of odd sensations to their mouth with kiwi, I test them straight away for kiwi, banana, and latex.
Interesting. Amazing.
And I also test them for three pollens, especially one called birch pollen, just to see if it is a pollen food syndrome.
Amazing. And can you test, depending on allergy seasons, can you test that, what difference of types, so that you know how to combat your hay fever? This is more for the.
Um, okay, in when it comes to skin prick tests, a skin prick test, depending on the solution, normally we test for about 7 to 10 different pollens altogether. Now, if you want to know specifically what is the pollen that affects you,
Mhm.
yes, it can be done as well. But for that, we need to do a completely different test. That needs to be a blood test.
Okay. But
But yes, we can.
and can you often sort of target the right type of medication if you know which pollen is irritating you or not really?
Medication is the same. A fever, and again, if we're talking about what people normally go for, is antihistamines. No, wrong. A fever, nasal spray. Things start on the nose, treat your nose.
Okay, that's very good to know. Um, Nasal spray. Oh God, what is the thing that I'm on? There's a new thing. Lucinda Miller, who's a naturopath, who I absolutely love, has suggested something with C, beta C, and so quercetin. Quercetin, is that right?
There's one that's called quercetin. I don't know if it is the same. Okay.
Yeah.
So those will not treat or prevent allergic rhinitis. The way that most of these medications from naturopathy work is they have some sort of oils, and what they're trying to do is to coat the mucosa of the nose, trying to prevent the allergen from being reacting to the mucosa. So it's not a prevention. So it's not an antihistamine, it's not a steroid to prevent the granulation of the mast cells. That's what it causes the allergic reaction. It's not that. You're coating it. Sometimes it can come with side effects, but it coats. So it's basically, it's like picking up a paintbrush with oil, putting it in your nose. That's how it works.
Okay, brilliant. Yes, someone's just said quercetin or whatever.
Yeah, that's the thing. Yeah.
I've only got 3 or 4 more. The next,
Okay.
which foods are likely to cause allergies when weaning? Obviously, nuts, I've heard, but what about strawberries and tomatoes? I know we've sort of touched on that now.
Okay. So first things first, we start to introduce egg. So egg is normally one of the ones that tend to cause the first allergic reactions that I see. And because we tend to tell parents to introduce egg and peanut, those are going to be the first ones. Now, if you're going to go for the rest, fruits and vegetables, no, rare, very rare. When you start to introduce fish or meat, fish can cause allergic reactions. Meat, again, different thing. It's rare that meat causes allergic reactions, and most of the allergic reactions to meat are either a confusion of symptoms, or it's something that we can work on to outgrow. So
Brilliant.
egg, peanut, and fish I would put as the first ones. Of course, not talking about milk that has been there since birth, but looking at that one. The other one, wheat and oats, because you start to introduce breads or porridges, and either they have wheat or oats. So look into those ones as well.
And would you say just introduce slowly and keep a note of what's going on?
Yeah. So it's always a good idea to do a food diary.
Mm-hmm.
Even if it is for a month later, you pick up the food diary, throw it in the bin. Brilliant. But at least if something happens, because when children come to me and they are 1 year old and I say, okay, I'm going to ask you back to 2 or 3 months of age, very often people don't remember.
Yep.
It's very hard. But if they kept the food diary, is extremely helpful. For
Yep.
me, is extremely helpful.
Fantastic. Good advice. I have just started weaning my baby and he seems to be a bit of pain and quite gassy. Do you think probiotics would help with that?
Um, Unlikely. The probiotics that we know, if it is associated with diarrhea, there's a few probiotics that are very well known to help with diarrhea. Now, giving probiotics to treat gas actually might not do it. The reason for this is, um, what is gas? How is gas produced in a large bowel? Bacteria, they feed on sugar. The byproduct of feeding on sugar is creating gas, methane. If you put more bacteria there, there's more bacteria to feed on sugar, more gas to be produced. So potentially can cause more problems. Also, another thing that people need to think about probiotics. If your child is allergic to milk, you need to see if the probiotic that you want to give has been cultured in milk or not.
Of course.
Because the protein might be carried around and can cause symptoms as well.
Very interesting.
So,
brilliant. And vitamin D, someone said vitamin D can help support the immune system. Would this help with things like eczema and asthma in that sort of case?
okay. There's no evidence about that. I tell everyone that I meet, take vitamin D. Everyone. Living inside, outside, everyone. Children, adults, everyone should take vitamin D in this country because sunlight exposure is very low. Now, no one still fully understands the role of vitamin D. Vitamin D is an amazing vitamin, and as you said, it does boost the immune system, no doubt about that. But some people have been doing studies about the possibility of prevention of asthma and eczema, as you say, but there's studies going other way. Some studies that say have no effect. Some of them said a marginally improvement in effects by using vitamin D. What I say is you don't stand to lose anything at all by taking it.
Fantastic. And you can't OD on it. The amounts you're taking, it's like one squirt for little ones.
Unless if you take a box of them,
yeah.
You know. Most of those medications, the dose for you to overdose it is sometimes 100 or 1,000-fold.
Yeah.
And a lot of them, if you take a little bit in excess, you weed it out.
Fantastic. I'm going to send you ours because Zita and I have our new range. I'm going to send that to you tomorrow. I'd love to hear what you think.
Oh, by all means.
Now, the last question we have is at what, and I'm sorry, I feel like we've been chopping and changing, but there have been so many and then different ones.
It doesn't matter. It's nice.
At what age does reflux warrant investigation?
There's no age in specific. If it is problematic, it needs investigation. You just need to find out what investigation you need to do. Again, like in anything in medicine, not just in allergy, start from scratch, start from simple. When people try to complicate, I tend to say to my juniors, what is rare, so let's investigate it for last. What is common is common. Address first the common issues. If the common issues are not solved by that, start building up on that one. And it comes to a point, depending on this range of involvement with the child and with the mother, if nothing works, then it needs to come to a point in which, okay, we need to go to further investigations. So it's not a matter of age, it's a matter of what has been done before, what have we reached now. We have children at 3-4 months of age that we need to go. I have children in which we have to put all sorts of tubes, including the ones on the tummy, for them to be fed at 2 or 3 months of age. But we're talking about children that had complex problems. So there's not, again, pediatrics, there's never a one-size-fits-all. It's not like in adults.
Yeah, of course. One other thing, just talking about reflux, and you know, there obviously the different types, the silent and the normal reflux. With my children, it was very easy to see because there was so much milk just coming up, just spilling out of their mouth throughout the day. But obviously, lots of people have this silent reflux. How do you know if you've got that?
Okay, silent reflux. There's a few things that normally say. A child that as soon as you finish feeding, either breastfeeding or bottle feeding, you try to lie them down and they refuse, and you need to carry them for hours until they settle. One of them. The other one hiccups. Frequent hiccups is a sign of reflux.
Oh, interesting.
So that those two signs are the ones that I focus more. If the child, because the other reflux that comes out, we see it. But
Yeah,
those ones are the ones that are very frequent. And hiccups, because it has to do with the acidity going into the esophagus, and they stimulate a nerve that goes along the esophagus and that innervates the diaphragm. So as it is stimulated, the diaphragm starts contracting, and as it starts contracting, we start having hiccups.
got
So
it.
that is one of the signs.
That's
Yeah.
so brilliant. Or have you missed anything, do you think? Is there anything, I'm sure, but is there anything that you think for mothers who are worried about all of these allergies and intolerances, is there anything else that we've missed that could be interesting for our listeners?
It's mainly what they should look into. If they are worried, go to their GP, ask for a referral, ask for a referral to a dietitian or to an allergist or to a pediatrician. Because if they are worried, things should be carried on. And even if it is for the GP, because the GPs also can ask for advice. It's not just referral. So they have the chosen book, but they also have the advice and guidance. So they can send us a message
Sure.
asking, look, I have this mother asking for this. What do you think we should do? Because I go through all that, and sometimes I tell them, okay, refer to me. Others I say, no, it's not nothing, just do whatever. Go for that. And we need to see. For me, I would wish that most of the children, as soon as they had an allergic reaction, they would come to me, because it would make my life far easier and their lives far easier as well. So look into that one. The other thing is, please, when it comes to diagnosis, don't go into alternative medicine. It brings a lot of headaches. Unfortunately, children have died from going to do alternative medicine testing. And we need to prevent that one. So this is the main thing. Of course, regarding allergic reactions as such, we'll have hours of chat ahead of us to talk about so many of them and what can we do and what cannot do. We can leave it for some other point.
Well,
But mainly is that. Sorry?
would you come back on again? Because I'm sure we're going to have hundreds of messages after this.
Absolutely, absolutely,
Yeah, lots of
absolutely.
we'll save this, and of course we can, because mothers and fathers don't always have time to tune in live. So of course we'll have it on our IGTV, and please do share it with your friends, pay it forward, pass it on. Also, people have been asking if you see people privately. Is there any way to get in contact with you?
I do. If they go on my Instagram page, there's a website there, which is my web page. If they go on my web page, there's contact details there.
Brilliant. I'm going to call you tonight.
By all means.
Enough. That has been so informative, and really, I wish that I'd met you sooner.
No, thank you very much for the invitation. It's always a pleasure to try, clarify things. I love doing that.
Yeah, absolutely. Well, we've had so many people with wonderful comments just thanking us, and please do share this, guys, with friends and family members, and let's see if we can just get the word out there to get people seen sooner rather than later.
Absolutely. Soon. Soon is the word.
Yeah.
Early.
Brilliant. Oh, thank you so much. And we
You're
will.
welcome. Okay. See you soon.
Bye.